The quiet whispers of your grandchildren, the punchline at the end of a joke, the music of your favorite song. When you suffer from hearing loss, you miss the sounds that make life fun and fulfilling. But you do not have to miss out. At the JFK Johnson Rehabilitation Center for Audiology, a doctor of audiology will evaluate your hearing and recommend a personalized treatment plan to enhance the quality of your life. And best of all, today's hearing aids are small, are advanced in technology, and many are rechargeable so you never have to change a battery. Trust JFK for the highest level of clinical expertise and technical know-how available in the hearing healthcare field. If you want to enjoy all of life's moments again, call the JFK Center for Audiology today, conveniently located in both Edison and Monroe Township. Visit jfkaudiology.org. That's jfkaudiology.org. Or call 732-321-7063.
The information provided in the following program is not a substitute for or intended to be medical advice. Medical advice can only be provided to you by your personal physician.
Hello again and welcome to JFK Spotlight on Health, and I want to thank you for giving us 30 minutes of your very busy day. These are going to be 30 very healthy and exciting minutes, I promise you that. My name is Bert Baron, and as you know, it is a new year. There's a lot of excitement out there, people trying to do the right things health-wise and whatnot, and of course staying fit, and that is what this week's program is all about. I'm joined by advanced nurse practitioner and certified diabetes educator Jane Hassey, who is with the Hackensack Meridian Health JFK Diabetes Center of New Jersey. And Happy New Year to you, Jane, and I guess I should say Healthy New Year to you as well.
Same to you.
This is a good time to kind of get things back in order in terms of good diet and good fitness habit, right? It all starts at the beginning of the new year for everyone.
Yes, it does, for most people.
We want it to start for everybody. That's why we're having this program here this week. But what can you say to people, Jane, when it comes to, getting into some good habits for the new year, when it comes to, let's focus on diet first and making sure that we're making good, smart food choices. What are some things we should do right away?
Well, right away, probably the first thing is to watch your portion sizes. Be careful with how much fat is in the foods you eat. Stick to healthier foods, high-fiber foods, fruits, vegetables, whole grains, low-fat dairy, lean meats like chicken, fish, lean beef, and just the biggest thing with most meal plans is just watching your portion sizes.
And it seems like as people kind of age, Jane, you can make some good food choices and you could eat a lot of certain things. But then, of course, as we get older, now it's about eating less and less at each meal. That's an important thing as people age, right?
I think for the general public, we all eat too much. As you age, your metabolism does change a little bit. Portion sizes should change a little bit, but I think we all need, no matter what age, to watch the portions we're having.
Maybe you could address this rule of thumb that I think a lot of people follow, and I don't know if I buy into it completely or not, when they say there's no such thing as bad food, only bad food habits. That's not completely a true statement, is it, Jane?
Yeah, I think it probably is. Our motto here is pretty much you can eat anything in moderation. But, of course, we need to promote healthier choices when we do a meal plan. The healthier choices would be staying away from things like chips and candy and cake and cookies. But we're all human. We're going to do it at some point in time. So, again, the bottom line is watching the portions. 2 cookies instead of a bag of cookies.
That's a good start. That would be a good start for a lot of people. And one of the things that you offer there at the JFK Diabetes Center is personalized meal planning. Talk about the steps that go into that and putting individual meals together for people. What's the idea behind that?
Well, what we do generally is the patient or the person, the client, makes an appointment, sees a dietitian, a nutritionist, and what they do is they weigh the patient. They talk to the person. They ask them what their goals are. Is it to lose weight, maintain weight, gain weight? What are their eating habits? What do they like to eat? And they try to personalize the meal plan based on the person they're talking to.
And I guess it's true that no two people are the same, Jane. Everybody needs, you can't just take one sort of standardized menu and be able to apply that to everybody. Everyone's needs are different. We're all individuals, right?
That's correct, and we need to make the meal plan fit in to the lifestyle of the person we're talking to, because we want it to be a lifestyle change. And if we don't do that, it's not going to be a lifestyle change. People can't keep a menu for their entire lifetime. They need to be able to make choices and make healthier choices and eat different things. So we try to personalize the meal plan to your habits.
Let's talk about someone who is dealing with diabetes and the role that the JFK Diabetes Center of New Jersey plays in that. I have heard so many doomsday scenarios about the future of New Jersey and this country and our planet as a whole, as in diabetes is climbing at an alarming rate, and we face the real threat of not having enough insulin to treat everybody that will have diabetes someday. Is this just doomsday scenario stuff, Jane, or is that a real threat that we're dealing with?
I don't know about the amount of insulin we have. That I couldn't really tell you, but we do. Diabetes is in epidemic proportions in this country alone, and it is increasing in foreign countries too. So, yes, it is definitely increasing. New Jersey, the country alone, and there are millions of people who don't even know they have diabetes but do.
Yeah, pre-diabetes, I think it's a pretty scary thing, too. And I guess the thing, when you look at diabetes versus other diseases that people, unfortunately, contract, diabetes to some degree, and correct me if I'm wrong, in some people, it's something you could prevent from getting. That's not true in every case, but that does exist, right?
Well, there is research out there that says people who, especially if they're in the category of pre-diabetes, with lifestyle changes can either prevent diabetes or at least put off the start of diabetes in their lifetime.
Gotcha. And the skills training, the diabetes skills training that's offered at the JFK Diabetes Center, talk about what that entails.
Well, the skills training is basically we go over pathophysiology, what causes type 2 diabetes, how to treat it, and then we teach people how to do their own blood sugar, how to interpret those blood sugars and change things in their daily plan of living to meet more normal blood sugars. We talk about medicines, we talk about insulin administration, and then we try to make our clients make an appointment with a dietitian, and she teaches just meal planning.
Has science and technology made that process, Jane, any easier for people when it comes to testing your blood sugar on a regular basis? As people right away think blood and needles, and it's kind of a scary thing to them. Has technology made it a little more friendly for people that have diabetes?
The meters that do take blood, where you have to stick your finger, are a little bit more updated than they were a long time ago. You need very little blood. Mm-hmm. The pinprick doesn't hurt. They're working on putting scanner kind of technology on the market where you don't have to stick your finger every time you need a blood sugar. There is one meter on the market now that does that. The idea is now to get insurance companies to pay for that.
Okay. Our guest is Jane Hassey with the JFK Diabetes Center of New Jersey, advanced nurse practitioner and also a certified diabetes educator. When we come back on JFK Spotlight on Health, we're going to talk about the various support groups that are offered, also some Medicare classes, weight management I want to touch on this time around. We'll talk about some fitness center classes and also some community speaking engagements that are going to be happening very soon, where you could kind of attend these and get some really, really great information and make this year the healthiest one yet. Don't go away. Much more coming up on JFK Spotlight on Health. Welcome back to JFK Spotlight on Health. My guest this time around is advanced nurse practitioner and certified diabetes educator Jane Hassey with the Hackensack Meridian Health JFK Diabetes Center of New Jersey. We're sharing some great information. We want everybody to get off to a nice, healthy start in this new year here. Jane, before we pick up our conversation, someone listening to us today, they want to reach out. They want to take that first step towards education and getting in better shape. How do they begin that process? What's the first thing they should do?
Well, the first thing they should do is certainly consult their physician. We see patients one-on-one counseling. Our number is here directly to the Diabetes Center is 732-744-5944. We're also listed on the Hackensack Meridian website, which is hackensackmeridian.org, and then the JFK subtitle on that website.
All right. We'll take a look for that. You mentioned about one-on-one training. We mentioned earlier about how everybody's different and everyone's needs are different. Talk about why the one-on-one training is something that is very important with what's offered at the Diabetes Center.
One-on-one training is important because everybody is different. We don't all work like the textbooks say we should. So we try to personalize our education based on what the patient is telling us, what their lifestyle is. We look at blood sugars, what their blood sugars are running, and we listen to what they're saying so that we can help them change their own lifestyle and hopefully make blood sugars better, weight loss if that's their goal, healthier eating habits, those kind of things.
Sure. And the support groups, are they an ongoing thing while someone is actually active at the Diabetes Center, or is this something that they'll continue on as they make their way through their journey of the life? The support groups, is that an ongoing thing?
Well, we have a support group here at the Diabetes Center for insulin pump users, and that meets once a month. Generally, for other people, we do follow-up appointments, usually about a half hour to an hour, to make sure their blood sugars are still running in what we call a good range and that they're losing weight or maintaining their weight, whatever their goal was.
Gotcha. And as you mentioned about the weight there, I mean, that's the million-dollar question for everybody because it's always one of two things. Well, I'm going to stop smoking or I'm going to lose weight. Everybody looks at that in January. I wish everybody would just kind of follow through and make it happen. But weight management is something that so many people I know, including myself, Jane, I feel like I wrestle with. I saw my doctor recently. As I was leaving the office, he said, Bert, lose 10 pounds. And before I could get to the door, he said, better yet, lose 15. I'm not alone. This is something that a lot of people, just a few pounds here and there, of course, you're going to look better, but it's about feeling better and being healthy. That's the bottom line, right?
Yes. The bottom line is if you lose weight, if you're overweight and you need to lose weight, losing weight evens out your blood sugars, makes your blood sugars more normal. It actually makes your blood pressure normal, lowers your cholesterol, lowers your triglycerides. So all that can help with almost any kind of chronic illness that you have. Even heart disease and those kind of things, it helps to lose weight, maintain your weight at a good level.
It's amazing how everything all of a sudden gets better when you lose a little bit of weight. The stress on your knees and your ankles all of a sudden goes away. You're sleeping better. You feel more energized, and there's so much upside to it. But I also think, Jane, sometimes people confuse weight versus body mass, and that seems like something in recent years that the body mass is almost as important, if not more important, than the actual weight. Talk about the differences and which one is more important.
Well, our dietitians, and I'm not a dietitian, I'm a nurse, but our dietitians use both to set up a meal plan. They use the weight and what the patient's goal is, and then they use a body mass index. Body mass index basically measures fat more than weight. So we want to get rid of your fat, and that certainly helps with diabetes at least. To regulate your blood sugar.
So it sounds almost like once one improves, the other one has to improve also, and it's sort of like
definitely both will improve. Once you lose weight, you're going to have a better body mass index. A little bit of exercise increases your muscle tone and helps your body mass index.
A lot of upside. You're right. And now is the time to definitely get started. Group classes, that sounds like a nice way to kind of get people motivated. Talk about what people can expect if they take a group class.
Well, what we try to do when we do group classes, we do try to make, and again, it's only because people are different and they don't all act like textbooks. We do try to make a one-on-one appointment with at least a dietitian to get a personalized meal plan. And then the classes go through diabetes, what diabetes is, the kinds of diabetes that there are out there, how to do your blood sugar, what the blood sugars mean, talks about A1Cs a little bit, goes over eating out, how to read a menu so you're picking healthier choices.
So there's a lot to learn in these group classes here. It sounds like a lot of different things.
Oh, yeah.
Okay.
We teach a lot of information, and sometimes the group classes work a little bit better, only because it focuses on one piece of it, and it allows people to absorb that information.
I like it.
Rather than trying to give it all at one time to one person.
What a great approach. And it sounds like it's success and results driven, which I think is what people are looking for. Supermarket tours. Is this like real field trips that you take, where you take people out to the supermarket and teach them how to shop in a healthy manner?
Yes, we have done that, and we did one. I think last year we did one, and it was fairly well attended. We actually do a tour of the supermarket and talk about where the better foods are to shop for, what aisles you should not be going down to shop. Yes, that's exactly what we do. It's a field trip.
I like it. I was always told that the concept of what they call perimeter shopping, where it's like just kind of stay around the outside, where there's dairy and there's fresh produce and there's some meats and some proteins, all the good stuff in a supermarket. I guess it's still true. It's kind of like around the perimeter and the outside. All the bad stuff, the potato chips and the snacks and sodas, all that stuff is in the middle. So if you kind of stay to the outside, there's healthier choices. Does that still apply?
Yeah, we still try to encourage people to do that. I mean, it's not 100%, but it is better than if you go down the potato chip aisle and pick up 10 bags of chips.
Yeah, have a healthy snack. Yeah, there's lots of healthy snacks at the supermarket if you just kind of look for them.
There are.
Of course. We have one more segment to go this time around on JFK Spotlight on Health. We're going to rejoin Jane Hassey coming up. We'll talk about some fitness center classes, and also there are some community speaking engagements that are in the works. We want to give you all the information on that coming up. We'll come back and wrap up JFK Spotlight on Health next.
I'm Michael.
And I'm April. We're husband and wife, and together, we lost nearly 200 pounds.
Do you want to know our secret?
We both went to the JFK for Life surgical weight loss program.
JFK for Life is a comprehensive weight management program specializing in both surgical weight loss and non-surgical weight loss. Your journey will include an entire team of clinical experts located close to home, remaining with you for ongoing encouragement and support. From nutritionists to fitness counselors to board-certified surgeons, we know it's not the amount of weight you need to lose. It's how your life will be different once you lose the weight. JFK for Life has been recognized as a Center of Blue distinction from Blue Cross and an Aetna Institute of Quality.
Why wait? Lose weight.
Visit jfkforlife.org today.
Learn more about JFK for Life and the success of more than 1,000 weight loss surgeries performed. Visit jfkforlife.org and watch our free weight loss seminar at your convenience. We're back to wrap up this week's edition of JFK Spotlight on Health. My guest has been Jane Hassey, advanced nurse practitioner and certified diabetes educator with the Hackensack Meridian Health JFK Diabetes Center of New Jersey. Changing lives, I'm telling you. Maybe this is the year that you need to do it for yourself. Jane, I want to talk about a couple of other things before we wrap up this time, but contact info again, if you could, the phone number and website where people can get some more info.
Okay, Diabetes Center of New Jersey, JFK, is 732-744-5944, and we are on the website, the Hackensack Meridian Health website, which is hackensackmeridianhealth.org, and just look at the JFK subtitle.
Is a referral needed? Should we go to our regular doctor first, or can we contact the center directly?
If you would like your insurance to pay for the visit, we need a prescription from the physician.
Okay, so go see your doctor first. I'm sure he or she would love to see you. It's probably been a long time since you've been there. So
yes.
Go and say hello and say you're interested in going to the JFK Diabetes Center of New Jersey, and they'll get you there. Talk about the fitness center classes, Jane. We talked about diet and how important that is. Now we got to get people to exercise and work off all this winter weight that they've put on. Talk about the fitness center classes and what's so great about those.
Well, first of all, from our perspective, exercise is very important in maintaining your blood sugar at a good level. It is also very important, as you have said, for weight loss, blood pressure, cholesterol, maintaining your cholesterol levels. The fitness center here it's a gym, so they have all the equipment that goes along with any other gym you would join. They also give classes. They have senior classes. They have boxing classes for Parkinson's disease. They do regular fitness classes. They have a yoga class for pregnant women. So they do numerous classes, all which help you maintain weight, maintain muscle strength, the things you need to do all along through your life to stay healthy.
Nice.
We also we have been offering Diabetes Center clients a free class once a month, and then trying to get them to join the gym to routinely exercise.
Yeah, get the heart beating, get a little sweat going, and it's amazing how good it feels. And all you have to do, it's like anything else. If you get in the routine of doing it, set aside a little bit of time each day to just do a little bit of exercise. And before you know it, you get to this point, Jane, where it's like, I have to exercise all of a sudden becomes the priority versus all the reasons that you used to use why you didn't exercise. It's just a matter of getting it started and building up a good routine. And when you start to see the results, then you really, really want to work out.
Yes, and I try to tell the people that come to see me that people who come home from work and take a walk are just as happy as people who come home from work and sit on the couch.
You're right. The only difference is they're maybe a little bit healthier, right? So that's the thing you want to instill, too. That's great. That's a great analogy, and hopefully people will take you up on that. For years, Jane, no surprise, JFK Medical Center, and now, of course, the affiliation with Hackensack Meridian Health have always been just great community partners and great sources of information for the community. And there's some speaking engagements that are coming up very soon with regards to today's topic. And I wanted to just get some specific information from you about what exactly these speaking engagements are all about. Can you talk about that a bit?
Sure. The Diabetes Center is involved in several speaking engagements in the month of February. The month of February is Heart Health Month or whatever they're calling it. Mm-hmm. So we are going to speak on diabetes and heart disease. We're going to do February 12th in Clara Barton at 11 a.m., February 13th in North Edison at 11 a.m., and then Edison Library on February 21st at 1 p.m.
Are these people need to sign up in advance for these, or they can just kind of come on by? How does that work?
I think they can just come on by.
Okay.
I don't think we're looking for a sign-up.
Okay, and these are free programs for people to attend?
Free, yes. They're
right.
Community. We're just doing community service when we do these.
Excellent. And anytime you can make a community healthier, Jane, through education and information, it really is a boon for everybody. It really is. We can get this information on the website also?
Yes.
All right, we'll be sure to take a look at that. And it's about, I always struggle with getting young people into some good habits, Jane, because I think when you have healthy young people, they become healthy adults, and we have a next generation of people that is in some good, healthy habits already. So education and information, particularly for young people, is still a priority, right?
Yes, and that is becoming an epidemic in this country with obese children. We do have a couple of dietitians who see children pretty frequently for weight management kind of education. So we are in tune to children and what they like to do and how we can help them better monitor what they're eating and their exercise or movement or activity.
Sure. We talked earlier in the show, Jane, about some advances maybe in science and technology and medicine that have kind of made dealing with diabetes a little bit simpler for people. Is there anything else you feel maybe that's on the horizon, maybe in terms of a breakthrough or some other things that maybe you're excited about in the future of treating and dealing with and maybe even preventing diabetes that you're excited about?
Well, they have there is a CDC research program they've done. There is a whole program that some places are doing to prevent diabetes. It's a diabetes prevention program, and it talks a lot about healthy eating and exercise and movement and keeping more active. there's always research out on how to better medications that are out there, better insulins that work more on a predictive kind of note. There are people working on doing blood sugars without, sticking your finger 4 or 5 times a day. So there are things in the making. There's always research going on as far as especially type 2 diabetes.
Good. Very encouraging stuff. Jane, as we wrap up this week, one more time, if you would, the phone number and website with the contact info.
Okay. Our phone number, it's JFK Diabetes Center of New Jersey. It's 732-744-5944. And then we are on the website, HackensackMeridianHealth.org, and the JFK section.
All right, terrific information. Jane Hassey, advanced nurse practitioner and certified diabetes educator. Great speaking with you this time around on JFK Spotlight on Health, and I wish you all the best for a happy and healthy new year, and thank you for the information.
And you too.
Thank you. Thank you. And you've been listening to JFK Spotlight on Health. I'm Bert Baron. Until next time, you have a healthy day.